Good morning. It's July 9th, 2024. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. Our patient just had the cervical Deuk plasma rhizotomy for facet joint pain on her left side. And now we are, thank you, Monica, we're going to be doing the Deuk laser disc repair to fix 2 discs. So she didn't just have a disc problem, she had facet problem. Very common, about 25% of our patients have both facet issue, that's fine, and disc problems. You can bring your collimator down a little bit, tiny bit. Okay, the first thing we're doing, our patient is facing up, she's intubated, she's completely asleep under general anesthesia. I'm going to access the front of the spine. All right, 5, 6, 6, 7, everybody agrees? And shot. 2, 3, 4, 5, 6, 6, 7, perfect. So I'm going to start with 6, 7, shot. I'm going to come south. You agree that's 6, 7? 2, 3, 4, 5, 6, 7, shot. That's 6, 7, AP. I want to make sure I'm in the middle of the spine. So I'm checking on the lateral spine x-ray view that I'm at the right level, and I'm using the front back view to make sure I'm in the middle. Shot. Yep, looks good. Lateral. All right, so on the front back view, we look at the spinous processes, make sure they're in between the pedicles, and then we take a picture and we go. Shot. All right, 2, 3, 4, 5, 6, 7. Shot. There we are. Shot. 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 AP. Oh, she's perfect. Yeah, she's got a nice thin neck, so we don't need a lot of muscle. I just need a quick AP. Monica, as fast as you can get it. Come to me a little bit. Shot. Looks good. Lateral. So I just moved to the left a little bit. Shot. Yeah, it looks good. All right, now let's do another AP. Quick. Zip it up. And shot. Perfect. Lateral. So I'm just checking. See, the position of the needle is really right on the spinous process. We're going to do a discogram at this point where I'm injecting some dye into the disc. There's 2 types of dye shot. One is perfect. Look at the herniation, guys. That's amazing. Show us the herniation there. Monica, can you use the pointer real quick? Or Nikki? Nice job. The herniation in the back, the little black thing at the back. You guys see it? The dye leaking out right there. Monica's got it. Perfect.
Yes, we can.
That is the herniation at C6-7. I'm going to numb the skin up. We're going to do a 4mm incision. We're doing the entire surgery arthroscopically. We're using a 4mm tube. That's the outer diameter shot. Perfect. And everybody agrees, right, Monica? 2, 3, 4, 5, 6, 7. So, got to make sure you're at the right disc. You don't want to operate on the wrong disc. It happens a lot in spine surgery, not at Deuk Spine, but at other places. Surgeons get confused. Surgeons don't have the best equipment. They don't have the best technicians. Shot. Automatic shot when I look up like that. Shot. And what happens is the surgeons make, a decision based on faulty information coming from a bad x-ray. Shot. All right, 2, 3, 4, 5, 6, 7. Perfect. Mallet. I already know I'm in the midline. I'm going to go through the anterior longitudinal ligament. Shot. I'm going to get to the back of this disc. Shot. Right where the herniation is coming out of the tear. Shot. She's got nice discs for her age. What's her age?
79.
Huh?
70.
70. So a lot of 70-year-olds have completely collapsed discs. Hers are well preserved. That said, they're still not normal, and she has 2 discs that are causing problems. 5-6-6-7, the 2 most common. I'm going to advance the tube over the dilator. Henry, while I'm doing this, why don't you show our audience how is it that a disc herniation can be so painful? What's the mechanism by which that happens? Take a look at the x-ray, Henry. You could see the tip of the endoscopic tube is at the back of the disc where the herniation and tear are. You could see from our animation, neck pain, headaches, they all come from inflammation that's at the back of the disc where the tear is. It's actually the tear where the pain comes from. It's not the herniation, it's the tear. And when you go in like we do with the laser and clean out that tear, removing the herniation that's stuck in there, then the patient's pain goes away. This patient's been in treatment with us for a long time. She's had conservative treatment. I need the lighting down a smidgen. Yeah, thank you. Good job. Whoever did that, way to be on it. All right. Any questions from our audience?
Yes, we have a question coming from Jerome on Facebook.
Hello, Jerome on Facebook. Welcome.
Asking from the last surgery, they asked, what facilitates arthropathy and how does the spurs develop?
Well, Jerome, great question. So what's happening is trauma is the cause of all joint problems that are not auto-inflammatory, basically. So like rheumatoid arthritis, for example, is an example of a genetic condition where your body has all this inflammation happening in joints and it's genetically determined. It's a genotype. It's basically you're born with those genes and your joints get inflammation, okay? Without trauma, maybe with mild trauma. But with osteoarthritis, which is a different condition, which is the most common condition, probably 90% of joint arthritis is osteoarthritis. And osteoarthritis just means arthritis or inflammation of the joints. Osteoarthritis requires a traumatic injury to the joint in order for you to get inflammation in the joint. In other words, you have to have a sports injury or a motor vehicle accident that would injure your joint, whether it's your facet joints, your knee joint, your hip joint, your shoulder joint. It doesn't matter. All these joints can be injured with trauma. Car accident, fall. I used to say go on YouTube and watch, what is it called? Fail Army. Anybody see Fail Army? You guys know what I'm talking about?
I do, yeah.
Yeah. So Fail Army is just a compilation of videos where humans do stupid things and like jump and they end up hurting themselves badly. When I'm, Fail Army, right? It's, it's people basically trying to get attention and make money on social media by doing stupid things, and they fail. And they don't realize that, oh, look at that reverse herniation. That's beautiful. That is a piece of herniation that came out of the foramen on the left side, which is where she's having most of her symptoms. And the point is that we do lots of damage to our bodies, joints, in our lifetime, whether through sports, through accidents, through stupidity. And those joints may not bother you when you have that injury, but years later they hurt. They will hurt. I mean, I have joint pain. My hips hurt because when I played soccer, I was playing on the United States national soccer team back when I was 14, 15, back in the 80s. And I hurt my hips playing soccer, and I had horrible pain. I had to sit out for a season when I was like 15 years old, and then it went away. and I did great. I went back to playing semi-pro soccer and all kinds of sports. Did great until I turned 52, 51, 52, I can't remember, and then my hips just started killing me. And it's from an old injury, okay, from back when I was in high school. So it's 100% joint injuries happen early in life. They turn into arthritis later in life. And that's from basically traumatic injury to the capsule of the joint. And then this inflammatory process that occurs because the capsule never properly heals. Same thing with the facet joint. The facet capsule never properly heals when you have a traumatic injury, and over time that facet joint just becomes full of arthritis, inflammation as the body's trying to heal it and unsuccessfully healing it. A lot of people don't realize that inflammation is a natural part of healing, and that anytime you get an injury to anything, your skin, your bones, your muscles, whatever it is, you're going to have inflammation. And the inflammation is your body's first response to injury. So the moment you get that injury, you get an inflammatory response. Okay, it's phase one, first part of an injury. And oh, look at that herniation, it just came out. That was sitting on top of the spinal cord. It came out of a tear in the back of the disc, not just an annular tear, but that was actually a tear within the posterior longitudinal ligament, which is behind the disc. It's a big piece of herniation. There's another piece. So what I was getting at is that basically, see the tear? Basically, injuries to joints causes your body to try to heal the joint unsuccessfully because you keep re-injuring it. And so there's this inflammation that never stops for years and years, which then eventually destroys the joint, and we call it arthritis. You get bone spurs, you get thinning of the cartilage, you get what are called end plate changes in the bone. So all that morphological garbage that happens, the destruction of the joint, is your own body attacking the joint with its inflammatory system. All right? So that's why people get pain in their facet joints, is they get this chronic inflammation as their body's trying to heal the injury unsuccessfully, and they just keep re-injuring it. Because let's face it, we all need to use our necks every day, right? We drive, we walk, we go to work, we play sports, we're moving our neck, we're moving our facets. So as you keep re-injuring the capsule, it keeps re-tearing, your body keeps trying to repair it, and the inflammation just goes on and on and on. And that's the same thing happening in the back of the disc here. She has this, you could see it, all this calcium, this little white stuff. Look at that. See the white on the edges of the herniation right there? That's literally her body's laying down calcium as part of inflammatory response to this chunk of herniation that I'm about to remove. It's too big to fit out of the tube. So I'm going to have to grab it with the grabber. That's why I took the scope out. I'm going to pull it out. But that's got calcium on the edge along with scar tissue because the body's inflammatory system has been attacking this thing, trying to get rid of it. Here it is. I just pulled it out. You guys see this? It's always better against blue. All right, that's probably 2 millimeter, 3 millimeter. Here. It's about, 3 millimeters, okay? And that's just one of many herniations. There's lots and lots of herniations. And each disc that we fix has about 20 to 30 herniations, probably an average of 25. So far we've removed 15. We've got more to go. Questions?
At this moment, no current questions.
All right. Thanks for asking. Thanks for being involved. But you could see this herniation at C6-7, guys, it didn't just tear the annulus. The annulus is completely ripped from top to bottom. But these are fibers of the posterior longitudinal ligament. That's behind the disc. And there's an anterior longitudinal ligament and a posterior. And we went through the ALL to get here, but that PLL, posterior ligament, is torn. And I always talk about herniations being subligamentous versus through the ligament. Hers is through the ligament, which honestly I didn't expect based on her MRI, but you can never tell from an MRI for sure. Sometimes you can, they're humongous, but a lot of times you can't. But 90% of herniations are subligamentous, meaning they don't go past the posterior ligament. This one clearly has, okay? Clearly has. All this is scar tissue right here, by the way. This cheesy you know, chunky white stuff. It's all due to the herniation. Herniations cause inflammation, which then causes scarring. This is all scar tissue. And there's a herniation sitting right here in the foramen on her nerve, and I'm trying to remove as much as I can. Luis, are we going to get 100% of the herniation? No. See that? He answered immediately. The reason why, because I've already said in the past, we never get 100%. There's another big herniation. And a lot of people think a herniation's one thing. It's not. It's not one big chunk of disc. It's many. And there's another one. Look, that's about 5 millimeters. Do you guys see that?
Yes, we
Henry?
did.
That's a bigger piece. Okay, and these are all just sitting there in the back of the disc causing problems. That's probably, yeah, 5-6 millimeters long. Okay, now we're going to take that and send it off to the pathologist, and they're going to say, oh yeah, pieces of herniation. We want to make sure we're not missing anything like a tumor, right? Tumors could look a lot like a piece of disc herniation. So we send our pieces, most of them, off to the pathologist just to double check. Oh, we already got another herniation here. So we're almost done with this disc, but another piece of herniation, too big to fit. So I got to go pull it out. Any questions? Henry. Here's another. You guys see that?
Yes, sir.
All right, and check this one out. This one's kind of cool. Can you guys see this, Henry? Bring it in.
Yes, we can.
Here's the other one, and here's this one. Now, the reason this is kind of cool, check this out. This is amazing, Henry. Amazing. I want this on the website for cervical. Okay? Let me show you why.
Copy that.
I'm going to show you why. This is so cool. Get in here and check this out. Can you see this piece right here, that it's a different color? It's more pink, red. The piece I'm pointing to. Can you see it?
Yes, we can. Yep.
That's inflammation. That's granulation tissue. That piece has been attacked by the blood system, inflammatory system, and it, just like a pimple is red, that piece of tissue is red because your body's attacking it. And that's where her pain comes from. That's a great picture. Please save that little ruler plus the two pieces for the website.
Copy that,
I
sir.
want it on the cervical Deuk laser disc repair page.
Copy that.
All right. Things are looking good here for her. Almost done with this 6-7. I'm feeling some wetness on my leg. Did somebody let a dog in the operating room? I'm leaning on the bag. All right. Luis, you doing all right?
Yeah.
Got the crud?
Yeah.
Sorry to hear that, man. What? Huh?
Hasn't made it to the floor yet, it's still on your leg.
Still on my leg, nice. All right, any questions, folks?
Is the suction on the back?
At this moment, no current questions.
Henry, can you show our audience, like, what a facet joint? We're not doing a facet treatment right now. We already did it for her. But can you show them what a facet, painful facet joint, how it causes pain?
Not a
And-
problem.
And then how we fix it at Duke Spine.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. And Henry, you showed our audience the facet, right?
Correct.
Like how it causes pain.
Yes.
But we haven't talked about the DPR yet.
No,
We
not
haven't
yet.
showed them the DPR. All right, so we've asked for orientation. On the left here is the bottom of the vertebrae of C6. And this is the back of that. We call it the end plate. And you can see the attachment of the fibers of the PLL right there, posterior ligament. Some scar tissue, pieces of herniation right here. Okay? And I'm just about done. I need one more minute on this disc and we're going to move to the next disc. And then there's the end plate of C7. So on the left is 6, on the right is 7, and we are in the trench. We are in the back of the disc, and I've cleaned out probably 75% of the herniation, 90% of what I can. And this is the foramen right here where the nerve root lives. It's sitting underneath this little bits of herniation. And it's those little bits of herniation that cause all the arm symptoms right there in the foramen. There's the torn posterior annulus, and there's the laser fiber at 12 o'clock, okay? 12 o'clock is really looking out her left foramen at 6-7. Okay, we're at the back of the disc. We are literally cleaning the tear, the annular tear. This is not a discectomy. We're not taking the disc out. This is not a fusion. This is the next level, folks. This is the future of spine surgery. And you're watching it first at Deuk Spine because we pioneered it. The rest of the world will follow. There's absolutely no doubt about it. However, it will be a while. We're done. It'll be a while for many reasons. The companies that make all the money selling the fusion metal and bone graft, well, they're not gonna, they're very invested in our educational system, and they are part of every university. They're in the operating room every day with the spine surgeons, and they've got an eye over the spine surgeons to make sure the spine surgeons are putting metal in everybody, as many cases as they can. And they have engineers, and they keep developing more metal products and more biological products, more stimulators and more grafts and more of everything, just to stick in human beings and make money. So that spinal industrial complex is not going away on its own. They will fight tooth and nail for the billions and billions of dollars in profit they make every year. Hospitals make billions of dollars a year in profit on spinal fusions as well. Artificial discs, spinal cord stimulators. There's so much money being made in invasive spine surgery that nobody wants to do this surgery because the payment is far less. For the surgeon, for the facility, there's just less money to be made, less profit by far, maybe 10% of what they're making. And human nature, they're going to want to keep doing what makes the most money. That's not how Deuk Spine sees it. We want to do what's best for the patient. Our bills too, but we want to do what's right for the patient. What's best for the patient, that's first and foremost. Shot. All right, any questions?
Yes, we
Shot.
have a question coming from Spyros on
2, 3,
YouTube.
4, 5, 6. I'm going to move up the spine. You guys can see we've lost like 2 drops of blood. That's it. This is a relatively bloodless surgery. Shot. 4 millimeter incision. Shot. That's it. All right. Shot. Hold on Spyros. This is the hardest part of the surgery. We call this the Deuk Spine slide. We pioneered it here. We're the first in the world to do it. Moving from one disc to another through an anterior cervical approach like this, endoscopic. When I learned the anterior cervical endoscopic approach from the Koreans, they only did one disc. The Germans only did one disc, but we're the first to do more than one disc. That's pretty horrible there. Can you get a real AP quickly? Quickly. All right, let's go lateral. Go, go, go. Give me a second, Spiros, and I'll answer your question, but I've got to get this dilator tip into the next disc. What are you doing there? I need a lateral, please, quickly. I don't know what you're farting around with there. 2, 3, 4. Shot? All right, now I need an AP. Quick AP, but it needs to be a real AP. I need to see the tip of the spinous process between the pedicles. All right, very good. That's perfect. Thank you. All right, let's go back to a lateral. We are in perfect position to enter the second disc, which is 5-6, and to perform our Deuk laser disc repair there. I am going to be advancing my dilator through the 5-6 disc, 2, 3, 4, 5, 6. You could see 5-6 is more sclerotic. See, when I hammer and then I look up, it means I'm waiting for you to give me information. Shot? Shot? Yeah, discogram? Sure, let's do it. All right, Spiros, what's your question?
Question coming from Spiros on YouTube asking, is the Deuk laser
Shot.
treatment available in Australia?
Shot. Yeah, it's not available unless I'm in Australia. The problem is this treatment requires very expensive equipment and a facility. Look at the tear. Show us the tear there, Monica, at the back of the disc. To the left. There, that's the tear. You guys see that?
Yes, we do.
That's the tear in the back of the disc where the herniation has come out. As Dr. Davis said, it's available not in Australia, but it's available in Melbourne, Florida. Listen, I wouldn't mind coming to Australia to do surgery. I really wouldn't. But the problem is all this equipment, I can't bring it with me. Can I, Monica?
Not very economically.
We'd have to rent 2 jets to carry all the people, all the equipment. That would be 2 giant jets at about 100,000 up each direction. Yeah, so we'd probably spend 200,000, no, 400,000, $500,000 on just transportation of everybody plus the equipment. And then we would obviously have to charge you for the surgery. So I just think probably end up being about $1 million. Or you could just travel here to Florida. It's not so bad. We have to rent a surgical center and, you know. The truth is that I think it would not be cost effective. All right, let's take a look. We are at C5-6. And there's the back of the disc. And it's the same story as last time. There's a tear in the annulus, which is the wall, which wraps around the entire disc, by the way. The annulus fibrosis, a lot of people make the disc out to be really complicated, but it's really not that complicated. It's quite simple. It has a annulus fibrosis and a nucleus pulposus. But what's interesting is that if you ask, well, what are the kind of problems that happen with a disc? There's really only one problem, maybe 2. And there's so many different names for all the problems worldwide, like slip disc, bulging disc, ruptured disc, herniated disc, protruding disc, extruded disc, prolapse disc, degenerated disc, spondylosis. Those are all the same thing, just different stages. So why does a organ in your body, the disc, have so many? I've got probably 8 minutes, Dr. B, we're done. 8 minutes, we're done. Less than 10 minutes. Why does such a simple organ, like the simplest organ in your body, literally the simplest, It's got a annulus fibrosus made out of collagen and elastin, and it's got a nucleus pulposus made out of proteoglycans and water. Why is this simple structure? I mean, it's the number one cause for problems in healthcare. Back pain, neck pain, radiculopathy, stenosis, all the usual stuff. Number one cause of lost work, number one cause of probably suicide among people suffering with chronic pain, drug overdoses, prescription drug abuse. It is literally responsible for so much badness in the world. Divorces, sexual dysfunction, anxiety, all these things. I mean, I could go on forever. You all know, you live with it. And yet it's got so many different names for the same thing. It all starts with an annular tear. And our new website is going to go into all this detail. I keep talking about the new website, and I apologize for the people who have heard it 1,000 times, but I'm kind of a stickler for detail. Henry will attest to that. And I'm not ready to launch this website until it's perfect. So we're going to launch it this month, I hope, as long as I can get my programmer to finish programming. But the good news is Sanjay, who's amazing, along with Henry, who's amazing, have stepped up in ways that I never expected them to. And they've really taken an active role in helping us complete the site, along with our team overseas. So we are going to have the site ready to go soon. And the good news is it's going to explain herniated discs in the neck, the back, the thoracic, facet pain, SI joint pain, piriformis, all these things that cause horrible back and neck pain. And it's going to be the first site in the world to do that, because no other doctors understand all the causes of back pain and neck pain. We do at Deuk Spine. We know more about back and neck pain, chronic back and neck pain, than anyone else in the world. And we're going to put it all on our website. 2 minutes, we're done. 2 minutes. Any other questions?
At this moment, no current questions.
Awesome. All right. I think we're done. There's really not a lot of herniation at 5-6. I don't see much. I'm going to take one more peek. We're done. Dr. B, you didn't believe me. And I don't blame you. Because I've lied to you in the past, haven't I? It's okay. We're talking about timing of anesthesia and ending it. Reversal. The problem is I always think I'm going to be done in a certain amount of time, and I tell my anesthesiologist so he can plan. And then I end up taking longer than I expect. And so he's learned.
Flexible venture.
Yeah, you are. Yeah, you are. All right. I think we're done here. I like it. I don't see any more herniation.
Thank you. Sitting on, actually.
You guys did great. I appreciate it. This patient has lost literally 5 drops of blood. If she had a ACDF, anterior cervical discectomy infusion, or an artificial disc, she would have lost 200, most likely up to 200 cc's of blood. We've lost 0.25. It is basically bloodless surgery. If you cut your toenail wrong, you lose more blood. 5 drops of blood. Great job, everybody. I'm going to show you all, because you stuck it out, I'm going to show you the incision. By the way, the whole surgery was done through this tube. You guys see this?
Yes, we do.
Yeah, tiny little tube, 4 millimeters wide. Good job, Luis. So the incision is tiny. It's 4 millimeters. And remember, we already did her cervical Deuk plasma rhizotomy. You guys see this?
Yes, we do.
Do you need more light, or is that bright enough?
That's perfect on my end.
Here, we'll put more light. So maybe
That's
you
even
can
better, yeah.
do this for the website if you want.
Copy.
How's that?
Perfect.
All right, done. We're going to put a steri strip.
Inside, please. Inside. Thank you.
Give it to me.
Yes, sir.
Scope use is a 5. I got it. All right, 6 drops of blood. All right, Henry, why don't you show our audience one of our patients that had the Deuk laser disc repair, and we can end the broadcast unless there's questions.
Copy that.
And good morning, I'm Dr. Artie Majan, CEO and founder of the Deuk Spine Institute. I'm here with a patient who has traveled here to have his neck fixed. He had a herniated disc. We did his surgery just yesterday.
Yes, sir.
It was outpatient, Deuk laser disc repair, endoscopic. How do you feel today?
I'd say probably 90 to 95% better, for sure.
Awesome. And what kind of problems were you having before that brought you here?
Severe balance issues, tingling in my arms and fingers. I had pain running down my leg, but I don't have nearly anything today. So big difference.
And your insurance covered your surgery, is that correct?
Absolutely.
And who do you have to thank for that?
Well, we've got you for one, and your whole staff has been friendly and kind, and you guys have always been on point with everything, getting back to phone calls and emails. It's been a hell of a process. Much appreciated.
You're welcome. And are you taking pain meds now that your surgery is over? A lot of people that have spine surgery, they're on painkillers for months afterwards. Are you on any painkillers?
No, sir, not at all.
None.
No pain enough to need pills.
Awesome. And you can see the small little incision. We went in with a 4mm incision on his neck, and we went through the front, back to the back side of the disc that was herniated, and we used the laser to clean out your herniation and get the pressure off your spinal cord and your nerves. Here you are now. Were you offered other types of surgery besides the laser?
I was a disc replacement of the C4-C5, I believe, and maybe C6. The recovery time was 6 months, 6 to 8 months of no working, no lifting, none of that stuff. I chose to go with Dr. Deuk just simplistically of, his overall success rate and the transition of being able to get back to work and getting my life back.
Awesome. And you don't have a piece of metal in your neck?
No, sir.
It's all natural. We went in and used a laser to repair the disc, and there's no metal, no plastic, nothing left in his body. You get your natural spine. Anything else you want to say to your fans out there?
Hey, believe in Dr. Deuk and the Deuk Spine Institute.
Awesome. Thank you so much.
Thank you.
All right.